Hi, I'm Dr. Elizabeth Harris. I'm certified by the American Board of Plastic Surgery. Some of you may be considering some type of body contour surgery. It may be that you have some extra weight that you've been unable to lose despite diet and exercise. Some of you might have had children or a massive weight loss causing you to have some irregular contours. And I'm going to talk to you a little bit about some of the different options available to you for body contour surgery. This includes abdominoplasty as well as liposuction. Men are a candidate for this type of surgery, and breast reduction surgery as well as liposuction are an option for them. And I'm also going to talk about the massive weight loss patient in regard to what different options are available to them. First, to start off with abdominoplasty. Abdominoplasty is the use of an incision along the lower abdominal wall to remove extra skin and fatty tissue that has become lax with weight loss as well as with pregnancy. And one of the ways that we do this is by also involving a tightening procedure of the abdominal wall musculature, because that frequently becomes stretched out during pregnancy too. Candidates for this type of procedure are those patients that have excellent physical health as well as the loss of elasticity along the lower abdominal wall. Sometimes an overhang is present. Sometimes the patients simply have a loss of the elasticity between the muscles, causing a protrusion of the abdominal wall in that area. The incision itself is an extended C-section type of incision, and we call it a Pfannenstiel incision. And that incision curves along the lower portion of the abdominal wall, and we try to hide it as best as we can with different type of bathing suits and different type of underwear. So I guide the incision so that it will meet a patient's need in terms of being as successfully hidden as best as possible. There is the option of a mini abdominoplasty versus a standard, and the mini abdominoplasty is simply a skin-only excision. We do this in the operating room under general anesthesia, and overnight stay is optional, but many of my patients go home afterwards. The second type of procedure that is available to patients considering body contour surgery includes liposuction. Liposuction is the removal of fat, and the perfect candidates for this are healthy patients that have good skin elasticity, that have areas that just don't go away despite diet and exercise. Typical areas are the saddlebags, as well as love handles. Some patients choose to do the area around the knees or the abdomen. And if the skin elasticity is good, they are candidates. Most plastic surgeons use some type of a sedation or a standard anesthetic technique in which it's done in a certified hospital operating room. Doing it with just local does present certain type of risks, and most plastic surgeons choose to have the comfort and safety of a hospital facility, and myself, as well as many other plastic surgeons, use a board-certified anesthesiologist for this type of procedure. What's done is that a small incision is hidden, and the incision itself is usually about the size of the width of your little fingernail. It's very, very small, and we hide it as best as possible so there shouldn't be many visible scars. And the fat is permanently removed. Most people don't realize with weight loss and weight gain, the fat cells simply either get larger or smaller, so you're permanently removing fat in a certain area. That's what makes this such a satisfying procedure. Body contour surgery for men has also become increasingly popular. Men wish also to have the benefits of some of the body contour procedures so they can look better in clothing, and I have men that don't like to go to the swimming pool without a shirt because they feel very self-conscious about their appearance, both of the breast as well as from the love handles and other fatty areas. So liposuction as well as breast reduction surgery for men are very good options, and patients are very happy with those procedures. Patients also that have had massive weight loss. After working so hard to lose weight, some people unfortunately have an overhang of some of the areas along the lower abdomen, inner thighs, arms, and those patients are unhappy about their appearance because of the sagging of the tissue. Sometimes when a patient is heavy, the elastic fibers become stretched, and after weight loss, those elastic fibers are unable to recoil and tighten. So one of the options for patients that have undergone successful weight loss is to do body contour surgery. And with this, we're able to remove the excess sagging skin on the abdominal wall. And if the weight loss is extensive, sometimes we even have to make the incision extend posteriorly in order to completely remove the weight that's bothersome to a patient. The arms are another issue. Some patients feel that their arm sagging has become a problem, preventing them from being able to wear many different types of clothing. And I have patients that say that they can't wear sleeveless shirts because of the appearance of their arms. Different options are available. The standard is called a brachioplasty incision, and the brachioplasty incision involves an excision of the loose skin so that the arm is tightened and the incision itself is hidden as best as possible along the inner portion of the arm, so that as a patient puts her arms to her side, the incision is hidden next to her body. Another option is a thigh lift. When patients have some sagging of the inner thighs, this is a technique that we use to tighten up the inner thighs and to give a better contour. That is a difficult procedure for some patients because of the nature of the anatomy, and each person needs to be looked at carefully by a board-certified plastic surgeon to determine whether they're a candidate for that procedure or not. Different body contour surgeries are available to patients, and what a person should do is first consult the American Board of Plastic Surgery website to find a board-certified plastic surgeon in your area. A consultation will involve evaluating the patient's medical history as well as looking at the degree of fatty protrusion as well as skin elasticity to determine what type of procedure is available to a person. Some patients may be a candidate for liposuction, which would involve smaller scars. Other patients may be a better candidate for an actual skin excision procedure, which the scars may be a little bit longer, but successful reduction of the extra skin as well as a removal of the stretch marks may be possible. Plastic surgeons should perform this surgery in a fully accredited outpatient or inpatient surgical facility, and the important thing is to look at the credentials of your surgeon and have that surgeon tell you what it would be best for your body, for your medical well-being as well as for the health. I'm Dr. Elizabeth Harris. I'm a board-certified plastic surgeon in San Antonio, Texas. My website is eharrismd, and my phone number is 210-545-4848.